right, so here we're gonna have a hip exercise where we're going to be working on freeing up space in that anterior, so front, joint capsule of the hip, okay? So for a lot of people who have like quad problems, so the quads, they come up here and then they attach right here. They're also the adductors, so the groin muscles, they come through here and they also attach up here. So this is a common spot where we have a lot of things that come together and their origins start here. And so there's a lot of times that people have problems with things here. And so the goal of this exercise is to create space there and get some solid results. So the way you set this one up is you're gonna need a foam roller and you're gonna wanna put it against the wall because you're gonna want to backstop to something that can hold it, okay? Then what we're gonna do is we're basically gonna get in a single leg hamstring bridge. So you're not gonna see my torso through here because I think I'm gonna be too close to the camera. But what's gonna happen up here is all this is just laying on the floor. Okay, and what you want to do is get here in this position. Let's say I'm working on my right hip. Okay, I'm going to bring this leg up. Okay, and I want this in a long lever, meaning that I have like an obtuse angle here. So this would be an acute angle. Something that's longer like this is an obtuse angle. Okay, I'm going to put my heel on the foam roller. You can do it with your forefoot as well. Okay, either one works. I'm going to do my heel. That just typically feels like I can get more activation there. So first thing we're gonna do is we're gonna take our pelvis and we're gonna posteriorly tilt it. So it's going to tilt up like this. So basically, I'm almost thinking about smashing my lower back into the ground a little bit. And you should almost feel like your glutes tighten up just a tad, okay? Then I'm gonna press through the foam roller so that my hips lift off the floor without losing that posterior tilt. Okay, and then from there, what we're gonna do is we're gonna rotate the hip outward into external rotation while maintaining posterior tilt, and then we're gonna rotate it inward, okay? Outward and inward, okay? And we're just repeating that, getting nice, solid movement through that hip capsule without stressing the anterior portion, okay? So if we're gonna start from the beginning again, I'm down here, everything back here is flat. I posteriorly tuck my pelvis. I drive up with my heel into there, or like I said, you can do it with your forefoot into there as long as you're maintaining that posterior tilt. And then I'm just going out with my foot or my hip and then in with my hip, out with my hip, in with my hip. And you should feel tension through that hip as you're doing it, and also some tension probably through your hamstring and your glute, because essentially it's almost like a hamstring bridge. So we're in that hip extended position and we're doing that. We're getting the external rotation and internal rotation, so just providing a lot of good movement for that hip capsule without stressing that anterior portion of the capsule.